здоров'я, Dina Pfeifer, представник Всесвітньої організації здоров'я, та Dragoslav Popovich, представник фонду UNICEF.
So we start our briefing. We have Mr. Dina, World Health Organization representative. We have Dina Pfeifer, World Health Organization representative, and Dragoslav Popovich, UNICEF representative. Dear guests, the floor is yours.
Very much, and thank you all for coming here this morning. WHO and UNICEF are real pleased to provide some additional information on the current polio outbreak in Ukraine. As I think all of you are fully aware, this is the second week of the second round of vaccination in response to the polio outbreak that was declared back in September here in the country. The preliminary results of coverage for last week, that is the first week of this round, indicates that only about 20% of the target population of children between 2 months and 6 years were vaccinated. That's a very significant underachievement, if I might say, from reaching a target of 95% of all eligible children by the end of this round of vaccination. As a reminder, the outbreak response recommended by WHO includes 3 national rounds to target and vaccinate all children between 2 months and 6 years. The third round, now tentatively planned for January, will target children as old as 10 years of age. So with that low coverage last week, WHO is recommending to Ukraine that this round be extended by an additional week. That is, we're in week 2. We're recommending that the vaccination campaign be extended for an additional week. So we've received some reports from our monitors in the field indicating that in some instances, healthcare facilities and healthcare workers are doing an exceptional job of reaching children and parents, reminding them to bring their children in for vaccination. Yesterday, we received a report from Kharkiv that a health facility with healthcare workers using their own telephones were sending SMS message reminders to parents of children who were vaccinated in round 1. So that's an exceptional going beyond normal expectations to ensure those children are protected. As a standard operating procedure, WHO has recommended, as it does in any country with a polio outbreak, has recommended that travelers to Ukraine acquire and be vaccinated with a booster vaccination of polio. So the seriousness of the outbreak is, we hope, been made clear repeatedly. We want to really encourage all parents, health officials, school officials, to ensure that the children in their areas are fully vaccinated in the time remaining. So I'd like now to turn it over to Dr. Pfeifer, who's going to expand on some of the issues we discussed.
Thank you very much. The oral polio vaccine is a WHO-recommended vaccine to interrupt poliovirus transmission in any setting, and it stops the transmission rapidly. That's why we favor this particular vaccine. WHO has recommended the use, and it's exactly the right product for this event in Ukraine. Children need to receive 3 doses of oral polio vaccine to be fully immunized and protected against polio. Oral polio vaccines have been in use for more than 50 years, and this means also for more than 50 years in Ukraine. It actually means that the parents of today's children have been vaccinated with the very same vaccine themselves. Therefore, we are urging them to provide the same level of protection for their children as the one that they have received themselves in their childhood. WHO also urges not only parents but healthcare providers and other political leaders to protect the children population by immunizing them, by bringing them to the vaccination sites this week and once again in January when the third round starts again. Thank you very much.
Thank you. Thank you, Dina. Thank you, Denis. My name is Dragoslav Popovich. I'm coming from UNICEF in Ukraine. And we mentioned several times the importance of use of the oral polio vaccines. On behalf of UNICEF, I'm pleased to inform that we have secured sufficient doses of the vaccines for this round, as well as thanks to donation of the European Union, we will have sufficient amounts of vaccines for the round that is planned for 18th of January. So we hope that by that time everything will be set to reach each child in Ukraine with the necessary 3 doses of the oral polio vaccine. I spent a couple of days in traveling in the country looking into dynamics around the vaccination. And as Denis was pointing out, you know, we cannot be too satisfied with what's happening in the field. I realized that so much depends on the trust between the health worker and the families. I realized that the personal example is extremely important. And as Denis mentioned, there are some people who are using their phones for calling and sending SMSs to parents to show up for immunization. I was also talking to several health workers about the issues of parent refusals and asking them, you know, how you deal with this kind of situation when someone comes to the immunization point and refuses to get the vaccination. And a couple of them were saying, you know, like, I keep the immunization records of my own children at my table all the times. So when the parents refused, I showed them, listen, I did immunize the kids with the same, my own children with the same vaccine. So if I did it, why wouldn't you? And I think it's really important for us to send the right information to the parents, to the medical community, share the examples, the good examples and practices that we see in the field, and mobilize more to do more, because obviously we are reaching only a fraction of children that should be reached with the vaccines, and without everyone is fully protected, there would be no protection for any child in Ukraine. So I'll stop here, and we will be ready for your questions, I guess. Thank you.
Thank you very much, Mr. Popovich. Чи є запитання або уточнення? Yeah, we have
Any questions? Yeah. Good morning, 1+1 TV channel. Could you please say if this level of coverage is small in the second and third round, will there be the fourth round, and at what conditions you will say that we have overcome this polio epidemic in Ukraine?
That's a good question. The experience in responding globally to these occasional outbreaks is that 3 high-quality rounds achieving 95% coverage is proven to be sufficient in stopping the transmission and eliminating the outbreak. So if Ukraine is not successful in achieving 95% in these 3 rounds, especially this and the 3rd round, I would expect there'd be a high likelihood of recommendations for an additional immunization activity to make up for the lost coverage.
And what is the need as outbreak stop when we have enough evidence to say that?
Well, a polio outbreak will be declared over after surveillance of acute flaccid paralysis that's routinely monitored throughout any country, no longer detects poliovirus in circulation within the country. So that's the gold standard, if you will, to determine that the virus transmission has stopped.
Thank you. Next question.
Уточните, пожалуйста.
Could you please clarify? Could you please clarify why the 3-valent OPV vaccine was purchased? We know that WHO will refuse to use it in 2016.
There are several reasons why it's so. First, this is the best vaccine that is available. This is the vaccine which is used in Ukraine for over 50 plus years. And this is the vaccine which is still used in a number of countries until the beginning of May next year, where all countries will simultaneously switch to use of another polio vaccines. This vaccine is, as Dina was saying, safe and effective, and this vaccine, and we can thank to these vaccines for the global progress in reducing polio cases so far, which been from hundreds of thousands of cases 2 decades ago to the a very few cases in not more than 2 countries. That is situation right now in Ukraine. So it's the best vaccine. It's the high quality product manufactured by Sanofi France. It's registered in a country, and it will be available for the round 3 and for some mop-up activities after the end of the round 3 if necessary. I hope this is the answer to your question. Thank you.
If I can just add, a 3-valent vaccine, the OPV, the oral polio vaccine, gives you a protection against 3 types of the viruses. Indeed, one of them has not been seen circulating since 1999 worldwide. Nevertheless, you would like to have your population protected against type 2 should it once again arise. And this is an opportunity to close the gaps in the immunity, because a number of cohorts of children in Ukraine have been left unimmunized over the past 5 years. So this is also an opportunity to give them not only immunity against type 1 and 3, but against type 2. As of May next year, we will be depending solely on inactivated polio vaccine to provide them with the protection against type 2. This is not specific to Ukraine. This is a global decision that has been reached at the World Health Assembly. There is slight difference in what you achieve with one and the other type of the vaccine, and the oral polio vaccine gives you a intestinal immunity, meaning antibodies in your gut, and this really prevents any spread of the virus in the community. So this is the added value that we wish to use in Ukraine and protect the children in addition.
Thank you very much. Чи є ще запитання або уточнення? Так, у нас є ще одне уточнення. We have one more clarification.
Could you please say how many international observers currently observe the vaccination process? And the next question, do you monitor the situation in the regions, in which regions the vaccination goes more actively, in other less actively? For example, Kiev is among outsiders in this process. Do you know why this happens?
Yeah, I'm not so clear on the translation.
I hope I got your questions right, but yes, there is a slight difference in performance among the regions of Ukraine. I think that was your question. Okay. During the first round, we were particularly facing the resistance from Zakarpattia, and we were also having a problem in the urban areas of city of Kiev. I think there are two reasons for that. The one reason definitely was in urban areas, it's always more difficult to organize campaign like this because you have many children to deal with, and there is a lot of migration within. We were also facing shortages of vaccines in some of the institutions in Kiev in the first round. I think all of these problems are right now resolved, and we hope that in this campaign, the second round is kind of running evenly throughout the country. However, the overall dynamics should be much stronger, and I think we should be doing better in all oblasts. So there is a possibility to, as Denis was saying, to extend this round for one more week so that we can complete the work on time and prepare better for the round 3 that would be in January.
And if I can go back to, I believe, one of your earlier questions about the number of international folks that have been brought in to help respond to the polio outbreak. Both WHO and UNICEF have been deploying over the past, actually 3 months now, what's called surge deployments. That is international staff from WHO headquarters in Geneva, UNICEF headquarters in New York, CDC Atlanta, and from the regional offices. So the total number of international support experts that have come to Ukraine within the past 2 months is approaching 80. Now that's in and out, but that's, I think, an important indication of the magnitude of the seriousness that the international community's commitment to helping Ukraine and support the government in responding to this outbreak. One more appeal I'd like to make on behalf of both agencies before this briefing is over is to really ask and encourage media to portray the issue as one of protecting children. That the children that are currently vulnerable to this disease are incapable, obviously, of making the decision to protect me, please. But schools, health officials, parents, civic leaders, church leaders across Ukraine, as adults, have the responsibility to ensure that their children are protected from this very real threat. So we appreciate your relaying a public health message that's of vital concern, not just to Ukraine, but to the international health community.
Thank you very much. Чи є ще запитання або уточнення? If there are no further questions or for presentation,
Since there are no
we're giving these messages to media and we hope they will spread the right message. And here we will finish our press conference. Дякую. На цьому будемо завершувати прес-конференцію. Наш наступний брифінг о 12:00 буде.
our further briefing will be at noon sharp.